I want to stand on all existing protocols, the HOD of Health, HODs all departments here, and distinguished colleagues. I've been told to talk briefly on the clinical benefits and aspects of this machine, and I was given about 10 minutes to speak, but I'm a man of few words, so don't worry, I won't spend 10 minutes here. 5 minutes, we are done. Without a doubt, the installation of this machine is a very significant and important milestone for our facility. But not just the facility, but the patients. But when we look at this new technology, the installation doesn't just bring this new technology, it has given us the clinical ability to detect disease much better for our referral doctors. Now, before I speak particularly on why we're so excited about this particular machine in the country, I would like to briefly just talk on the benefits of having a PET and what we might have been missing for a very long time in the facility. So the PET-CT is very useful for different branches of medicine: oncology, neurology, internal medicine, that's covering infectious diseases and cardiovascular system, and of course, so those four areas. And I'm proud to see that most of the HODs and representatives from those departments are here. Okay, so most of its value and work is with oncology. What a PET-CT actually brings for oncology is the ability to change the management plan in close to 30% of cases when an oncologist is managing cancer. So it actually tells the oncologist if I should go ahead, am I going to do surgery here, am I giving chemotherapy, am I giving radiotherapy or whatever. So that's how important it is, okay? Very useful for the neurologists. For a very long time, the neurology department, for example, they've been trying, there are certain cases of patients who have Parkinson's symptoms, okay? Most of them can be diagnosed clinically, but there's a particular group that is so difficult to diagnose them clinically, and you need PET-CT. Very useful, and it's been helping already. Okay, so there are various reasons and areas where PET-CT is so useful, but when we talk about this particular system, so it looks like sometimes it's worth the wait, okay? Because we are not just getting a normal PET-CT, we are getting a fully digital PET-CT. And I'm not going to be humble about this here. This is virtually one of the best in the country, without a doubt. Okay, at least in the public sector, in the academic setting, it's definitely the best. Okay, and so we are so lucky to have this and we're proud about it. So what makes it stand out? Okay, two things are very clear here. The detector crystal and a software hardware package called Time of Flight has given us the ability to detect diseases much, much earlier. And we see this every single day. I give an example. We had a patient recently who had prostate CA. He had surgery, but the PSA just went up just a tiny bit. He had done so many other investigations and they couldn't find where the source of the PSA was from. I had a PET-CT scan done here. I think it was done on Monday. Just a very tiny, small 0.3 millimeter lymph node, and it picked it up. Okay, and that changes the plan completely. The other day too, same this week, beginning of this week, we had a patient with breast CA. The patient had done a CT scan. The CT scan was completely normal to an extent. But because we have brilliant referral doctors, the patient was a bit of a high-risk patient, and that referral doctor had a feeling that maybe the CT is missing something. Let's do a PET-CT. And the PET-CT showed widespread metastatic disease and picked it up. Now, without a PET-CT, this patient would most likely have maybe had surgery because there is no metastasis. But with the PET-CT now showing that amount of metastatic disease, the patient has to go for chemotherapy. So you can see these are the kind of changes that take place, especially when you have a digital PET-CT system. But when we look at this cutting-edge technology, there are also so many other things that come into play. First of all, for you to have the clinical benefit at the end of the day for the patients, you need certain groups of people to bring out the best in the system. And the first one I always like mentioning, and the most important, is actually the technologists or the radiographers who image these patients. If these patients are not imaged properly, even the digital aspect of this system will not give you the best images again. You also have the medical physics team. They have to optimize these extra benefits of the digital test system to give you the best of images that you need. And you definitely also need the clinicians who have to record the scans. And then all this information, we sit down with an NDT, okay? That's our referral doctors. And we bring all this information together for a proper clinical diagnosis, and then the patient gets the best management plan at the end of the day. So this cutting-edge technology that we have here, I personally am so proud about it, and I think our patients are so lucky to have such technology close to them back home. Already, you can see that the department is already working so hard already with this machine, because the referral doctors, it's almost like they couldn't wait for the machine to come. I can tell you that this short period that we've already had this machine, we've already scanned over 300 patients. And that is actually because we are even a bit understaffed to an extent, okay? Sorry, I like taking opportunities when I can take opportunities. So I think the history of health is here. So, especially for the radiographers, no, but seriously, we have virtually 8 working radiographers. We have 5 imaging stations and 2 hot labs. It's almost impossible for them to do the job. Totally impossible. Okay, so if tomorrow you see submissions for more radiographers on your table, please just sign. Just sign it, please, so that we can get them going. Yeah, but fantastic and work for them because they're doing a lot for us. Yeah. So, but that said, we're very proud to have this machine. We can see the benefits already. We know that PET-CT changes the management plan in close to 30 to 40% of cancer patients. We are beginning to see that already. And I mean, when we're also reporting these scans with our colleagues from radiology, okay, they're like, oh wow, we did a CT, we did an MRI, we didn't see all this. How come you guys saw all this? And then we just like, that's a digital PET-CT for you. Okay, so this is a blessing for the patients, and it's good for them. But again, apart from the clinical benefit itself, we have to look at research. I mean, this is cutting-edge technology that is going to encourage cutting-edge research at the end of the day. So I think I must have explained everything clinically to an extent. I tried to explain it as much as possible as a layman so that people can fully understand. But if you have personal questions to ask later, you can always reach out. Thank you so much. So I think I'm going to welcome the HOD of Health to